Hello guys, this is myself Nadur San. Today I will explain a little bit about the microcycline, its family name, brand name, uses, side effect, mechanism of action, adverse effect, and the antidote and route of administration. So in the very beginning, the microcycline is a semi-synthetic tetracycline derived from Streptococcus aureofaciens, and it is mostly inhibitor of arginine vasopressin, and it is used to treat the bacterial infection like pneumonia, respiratory disease, lymphatics, eyes, skin problem, then in urinary system disease. Then it also used to treat syndrome of inappropriate hypersecretion of ADH in diabetes insipidus. Actually, it is used to treat those diseases which have fluid retention in our body, and it also can use in the case of plague. In these days it is using in case of hyponatremia. And if we talk about the mechanism of the microcycline, that the microcycline is inhibit the process of translation. Actually, it bind with the 30 and 50 ribosomal subunit, which prevent acyl transfer RNA to bind with a unit of ribosome, which is impair of bacterial synthesis. So if we talk about the side effect of demiclocycline, then demiclocycline may cause diarrhea, nausea, vomiting, change in skin and in mouth color. Then it may cause polydipsia, polyuria, then inflammation of glass penis. And if we talk about the adverse effect of demiclocycline, that demiclocycline may cause chest pain, chill, joints pain, swelling of legs, skin, face, lips, tongue. Then it may cause melena, then it's dyspnea, then headache, rashes. And the route of demiclocycline, it is orally take and 4 pills in a day, and the half life of demiclocycline is about 16 hours. And we can also use demiclocycline along with tolvaptan, colvaptan. Actually is ADH antagonist, and ADH antagonist, actually demiclocycline bind V2 receptor of ADH, and that bind with V2 receptor, and the last part of nephron, then water permeable. So when person take demiclocycline, then demiclocycline block V2 receptor by inhibiting adenylyl cyclase. When adenylyl cyclase inhibit, then aquaport 2 from principal cell don't go to the lumen side of the last part of collecting duct, and person have a diluted urine. So in this way we can use demiclocycline in case of SIADH and diabetes insipidus. So the related drugs we can use along with demiclocycline have tolvaptan, colvaptan, that is ADH antagonist. And if we have antidote, if we talk about antidote of demiclocycline, then we have desmopressin and sedatives drugs, and those drugs we have magnesium. In the magnesium we can use, and calcium supplement can also be used along with the demiclocycline. So this is a little bit a short introduction related to demiclocycline. Hope you will enjoy this video. Thank you very much.
Assalamualaikum. My name is Mariam Ali. I am from Osh International Medical University. Today my presentation topic is amoxicillin. What is amoxicillin? Amoxicillin is actually one of the amino penicillin, and it is a beta-lactam antibiotic. Mechanism of action: amoxicillin is similar to penicillin in bactericidal antibiotic. It inhibits bacterial cell wall synthesis by binding to multiple penicillin. Penicillin binding proteins are important during the transpeptidase of transpeptidoglycan synthesis. It acts through the inhibition of cell wall biosynthesis that leads to the death of the bacteria. Therapeutic uses about amoxicillin: it is used to treat bacterial infections such as chest infection, including pneumonia and dental abscess. It can also be used together with other antibiotic and medicine to treat stomach ulcer. Contraindications of amoxicillin: amoxicillin is contraindicated in the patient has exhibited a previous history of a serious hypersensitivity to amoxicillin or other beta-lactams. These types of hypersensitivity could include anaphylaxis or Stevens-Jones syndrome. So if the patient has presented previously with these types of hypersensitivity to amoxicillin or other beta-lactam antibiotic, we could not use. Adverse reaction. The adverse reaction including hypersensitivity cause and CNS agitation, anxiety, confusion, dyspnea, headache, skin rashes, and shortness of breath. If the patient allergic to amoxicillin to beta-lactam antibiotic. Diagnostic uses. Amoxicillin is used to treat certain infections caused by bacteria such as pneumonia, bronchitis, infections of airway tube leading to the lungs, and infection of the ear, nose, urinary tract, and skin. Side effect of amoxicillin. The side effect among seasoning it very well tolerated for the most common side effect of amoxicillin. It gastric intestinal upset or sometimes manifesting as diarrhea or nausea and vomiting. But on the whole it is very well tolerated. Rash may develop. A rash may need to be taken more seriously because it could be a sign and an allergic reaction. Drugs to drugs interactions. Drugs to drugs interaction occurs when a drugs interact or interfere with another drugs. This can alter the way of.
Assalamu alaikum. My name is Michelle Amar. I am from Osh International Medical University. Today my presentation topic is about the epinephrine. Epinephrine is also known as the adrenaline. It is a neurotransmitter and a hormone, but it also acts as a hormone. It plays an important role in the fight or flight response. It is secreted by the medulla of the adrenal gland. The location of the epinephrine that it is also present on the kidneys. It is produced in the times of the stress, such as the danger, excitement, and in the bright light. Its generic name is the epinephrine and the brand name is the adrenaline. Allergic, antioxidant, and the cetanist. Function of the epinephrine: low blood sugar, anaphylactic shock, open angle glaucoma, asthma, cardiac arrest, low blood pressure, and also along with the local anesthetic or to control the local bleeding. Formation of the epinephrine. The epinephrine is formed from the phenylalanine, and in the presence of the phenylalanine hydrolase, it is converted into the L-tyrosine. And then from the L-tyrosine, the tyrosine hydrolases, it forms into the L-dopa. And in the presence of the L-aromatic amino acid decarboxylase, it is converted into the dopamine. Then from the dopamine, in the presence of the dopamine, it will convert it into the norepinephrine. Then norepinephrine, in the presence of the phenylethanol-amine and methyltransferase, it is converted into the epinephrine. And the molecular formula for the epinephrine is the C9H15NO3. Mechanism of the action on the organ and its effects. On the heart, it increases the heartbeat and the contractility. On the lungs, it increases the respiratory rate and the bronchodilation. On the liver, it stimulates the glycogenolysis. Contraindications of the epinephrine: hypovolemic shock and the closed angle glaucoma. Side effects of the epinephrine are the sweating, dizziness, irregular heartbeats, nausea, vomiting, difficulty in the breathing, headache, and the high blood pressure.
Assalamu alaikum, Dr. Hamza. How are you?
Alhamdulillah, fine.
My friend have type 2 diabetes. Can you recommend any drug for him?
Yeah, sure. Lucky enough for you, right now I'm just studying about that drug actually. So that drug name is metformin, and I think it would be best suited for him. So do you have any questions about that?
Yeah, can you explain any mechanism or uses?
Yeah, sure. Mechanism. Its mechanism is that it inhibits mitochondrial glycerol 3-phosphate dehydrogenase, which is also known as MGPT, which causes the inhibition of gluconeogenesis and the action of glucagon. It increases glucolysis, which causes peripheral glucose, increased insulin sensitivity. So this is in short term, this all means that it will act on the liver and it will cause inhibition of hepatic gluconeogenesis. There will be no glucagon production, as well as when sensitivity of the insulin will be increased, so more insulin will be utilized in our body. So anything else? Uses?
Yeah,
Yes?
can you tell me about uses?
Uses. Yeah, this medication is often sold to public under the brand name of glucophage, which is also known as a long name for sugar eater.